I'm going to be touching your hips. Okay, can you lift, or I'm sorry, can you turn on the right side for me? Okay, and on the other side. Okay, turn on your side for me. Okay, thank you. Now we're going to do some hip exercises. Let me know if you feel any pain. I'm feeling pull up and push. Can you point your toes to your nose and down to the floor? Okay, you can set it now.
Checking your hips. So please lay back down. Okay, very good. So first I'm gonna feel for your right. Okay, so there's no pain on the right side. There's also no pain on the left with no crepitus or tenderness to both hips. So I'm gonna just check your range of motion here. Very good range of motion, passive range of motion, and there's also good passive range of motion on your left side as well. Okay, so what I'm gonna have you do, starting with your left side, please lift up your leg, move it to the left, move it to the right, bring your knees to the chest. Very good. Do the same for your right, left first, right, and then bring your knees to the chest. So that's good active range of motion. Now with my hands on this here, try to push against my hand, up, push up, lift up, very good. Okay, now don't let me pull you up, try to push down. Good, so there's good muscle tone on the right side. Doing the same thing here, don't let me lift up, don't let me push down. Very good, so there's good muscle tone on your left side. So let's measure 5 out of 5. Okay, so I'm gonna check your knees. Okay, so there's patellar is intact on both knees. No dislocation, no swelling, no bursitis on both knees as well. So I'm gonna just have you sit back up really quickly so we can test your knees. Okay, so there's, you can relax, very good. So there's good passive range of motion on both knees. Okay, so I'm gonna just have you extend both knees and bend both knees. So there's good active range of motion there as well. Okay, so with your knees, I'm gonna push against it, please try to extend it. Okay, very good. Now I'm gonna try to pull up, please try to flex. Very good. Okay, so there's good muscle tone there, and it's measured 5 out of 5 for both knees. Next, I'm gonna check your ankles. So I'm gonna pull it out here. Hold on. Okay, so ankles look good so far. There is no bursitis or any swelling on the ankles. Okay, so there's good passive range of motion on bilateral ankles. Okay, so first I'm gonna have you flex your ankles, extend them, turn them inwards, and then turn them outwards. Okay, very good. So there's good active range of motion there. Okay, so next I'm gonna test your ankle strength. Okay, don't let me push down and don't let me push up. Very good. So this muscle tone is good.
There. Legs are both even and symmetrical again. Sorry. And I'm not noticing any bulges or deformities, in her legs or her feet or ankles. Not noticing any muscle atrophy. She looks like she's nice and healthy and muscular. And like I said, no obvious, it's okay. No obvious deformities anywhere in her leg. I'm just gonna feel your hips here. Okay, so there's her ASIS. And I'm gonna go around to the back. And assess her posterior, superior iliac spine. They are even. I didn't notice anything unusual with that. And then, hold on, I'm going to kind of feel your tailbone here. All right. Any pain anywhere? Okay. Now I'm going to just kind of feel your knees here. Just feeling for any fogginess, seeing if the patella's in line. And there's the tibial tubercle. Okay. I'm just feeling all the way down her tibia here. And her medial and lateral malleolus. Achilles tendon. I'm not feeling any nodules or any pain or anything. Again, feet. Calcaneus is good. I'm not feeling any lumps there. And then the tarsals and metatarsals, toes, all nice and mobile. I'm not feeling any obvious deformities anywhere. Like I said, no bogginess or anything like that. So now we're going to check your range of motion in your joints. And for your hips, it might be easier to stand up. So I'm going to pause for a second. Okay, so to check the range of motion of your hips, I'm just going to have you bring your knee up. And that's flexion. And now the other knee, flexion. And extension, can you like put your leg back? Good. Now the other leg. I know, we kind of don't have a ton of room here. And then abduction, leg out. And then adduction across. Same thing, abduction, abduction. And internal rotation, just kind of, yep, and external. Good. Same thing, internal rotation and external rotation. Any pain with anything there?
No.
All right, and can you hop back up on the table and we'll check your knees. Okay, so knees flex, bring them in, and then extend, straighten them out. Good, everything looks nice and symmetric and fluid. Ankles, plantar or dorsiflexion is up, plantar flexion is down, and then abduction, adduction, eversion, can you like, yep, or inversion, and then eversion is out. Good. Oh, none of that showed up. She did them correctly though. Okay, and then toes. Let's put this down here too. Okay, toes. Can you curl your toes in and out? Okay, flexion and extension of the toes is good. And now I'm just gonna do a couple special tests here. Okay, hold on, one more pause. Okay, so now I'm just gonna make sure there's no obvious injuries on her knees. So I'm testing to see if there's any fluid up here in the bulge, like the bulge sign. I'm not seeing any. All right, just move it out. All right, and then I'm gonna test for a drawer sign to see if she's got any kind of ACL or PCL tear, and I'm not seeing anything. Okay, and then we're going to bring her leg like across here. No, that's not gonna work. All right, well, there we go. And I'm not seeing any LCL or MCL laxity. I don't think I did that right. I feel the edges of her meniscus. It's nice and smooth. So it doesn't appear to have any obvious signs of a meniscus tear. And same thing with her ankle. Hold down. And I'm not seeing any obvious signs that her Achilles tendon might be ruptured. It's nice and smooth and in place. Okay, you can sit up.
While you stay there, just keep your head back. And I'm going to just kind of lift your leg straight. That'll assess if you got any pain in your lower back. So I'm going to lift your leg a little bit. Any pain there in your lower back? I'm going to dorsiflex your foot. Does that hurt anything at all? Very good. All right, I'm going to do the same thing here. Dorsiflexion. Any discomfort there? Very good. Okay. So now we're going to test your range of motion in your hips. So we're going to just flex your knee there. Any discomfort? Okay, so we're going to internally rotate it and externally rotate it. Any discomfort there? So range of motion is good there. So let me move over here. So same thing, flexion, and then internally rotate it, externally rotate. You're okay there? All right, back down. Now I want you to put my hands here. I want you to squeeze your hips out or move your legs out. Good. Abduction there, and then squeeze back in against my feet. There you go. Very good. Now I want you to lift your arms, or lift your legs, excuse me, up against it. Very good. All right, now we're going to test your range of motion of your knees. Good flexion there. Internally rotate it, externally rotate it. So that's good. Same thing here. Flexion, internally rotate, external rotation. Very good. So now let's test your ankles there. So I want you to push up against it. Very good. And then pull towards you. Pull your toes towards you. Very good. So strength is the same but lateral. You can see that there's a little bit of a size difference in the two from the prior surgery when she was a child.
To push against my hands, okay? Okay. Try to lift your legs up against me. Perfect. Okay. Okay, I'm gonna go ahead and have put your heel to your shin, okay? You're gonna slide it down your leg like this one first. Lift your leg up. Does that hurt your back?
No.
Can you move your foot in for me this way? Perfect. Just get this up a little bit. You see like this though? Lift that up. Just straight. Does that hurt your back?
No.
Can you push on my hands like a gas pedal? Perfect. And you pull up. There we go. Alright, I'm gonna go ahead and have you scoot to the edge of